Today's guest is Dr. Philip Ovadia, a distinguished fellow of American College of Surgeons and a pioneer in metabolic health. Dr. Ovadia is a veteran heart surgeon, totaling over 3,000 heart procedures. Beyond surgery, Dr. Ovadia founded Ovadia Heart Health and published the book Stay Off My Operating Table. He is dedicated to equipping people with the tools and the mindset to improve their health and stay away from his operating table. Dr. Ovadia, welcome to the Primal Foundations podcast.
Thank you, Tony. It's great to be here with you. Really excited to have this conversation with you and your audience.
Yeah, thanks for coming. I love your podcast, which is also called Stay Off My Operating Table, and enjoy all the content that you put on Instagram. It's very informative, and I love seeing the reels as they come in.
Thank you for that. We've been on a mission now for a number of years to try and make metabolic health and heart health accessible, help people to really understand what are the true root causes of heart disease, which is, of course, the most common killer here in the US and worldwide. And it's what I came to realize through my journey as a heart surgeon is that we were taking the wrong approach to this disease. And what I now recognize is that every patient that ends up on my operating table is really a failure of the medical system, and that we should be working harder and focusing more on keeping people off of the operating table, because heart disease and most of the chronic disease that we face in society today are preventable, and we need to do a better job at preventing illness rather than just managing illness.
I love it. I love the whole message, and I love to get into it with you today. Before we get into, even because I have a lot of questions on heart disease and some of the contributors, things like that. You have a very interesting story. Can you tell the listeners and paint the picture of your background of your personal health journey even before you got into medicine?
Yeah, definitely so. I mean, the reality is that for the vast, for the first portion of my career as a heart surgeon, I was a very unhealthy heart surgeon. And this, goes back to childhood when I was obese, had been overweight basically my entire life, and had gone through the same journey I think that many patients got, many people and many of my patients went through, in that, you would try a diet, you would have some short-term success, lose some weight, but invariably end up gaining back that weight and more. And this continued, throughout early adulthood, certainly through medical school, very stressful time, not very supportive of good habits, surgical training, even worse. And then I was just a busy heart surgeon. And for, the first 10 plus years of my career as a heart surgeon, it was kind of nose to the grindstone. And next thing I know it, I am a morbidly obese, pre-diabetic heart surgeon. And one day I sort of just recognized that I was headed for my own operating table, so to speak. I have the family history, I had the risk factors, and like so many of my patients, I really didn't know what to do about it, because I did try and was following the advice that I had learned to give, the advice that many of us have heard: eat less, move more, eat a low fat diet. And it wasn't working for me, and it wasn't working for my patients. And thankfully, I started to come across some different information. I started to ask some different questions. And ultimately, I was able to overcome my own health challenges. I lost, 100 pounds. I've been able to maintain that weight loss now for going on 8 years. And along the way, I came to discover, like I talked about earlier, that we were really taking the wrong approach to heart disease, to obesity, and I needed to do a better job of keeping people off the operating table.
Yeah, and congratulations on like the weight loss and persevering through that? Because I mean, 100 pounds, that's a lot. That's
Yeah, you know,
amazing.
it's a lot to lose. It was a lot of weight to be carrying around, both literally and figuratively. It really, speaks to how unhealthy I was. But I hope that can inspire other people out there that may be just as unhealthy or even more unhealthy. Because I think it does say a lot that a heart surgeon, which and I don't want to make this sound egotistical, but many people would see that as sort of a pinnacle of medicine. And obviously, it's a lot that you need to go through to, that process to become a heart surgeon. And when you really step back and say, well, how can a heart surgeon become so unhealthy? It hopefully will give hope to all the people out there for them to recognize that if a heart surgeon can become that unhealthy, it's certainly understandable how they became as unhealthy as they may be. But the good news is it really doesn't take a heart surgeon to undo that problem. And I've been able to reverse it. And I've now worked with, many, many patients who go through that same journey and are able to overcome these health challenges.
Awesome. Awesome. And I want to start this next kind of segment, kind of a quote. I don't know if it's a quote or a saying. I've heard just listening to some of the podcasts and listening to you on other episodes. One of the sayings was, at least half of the information you learn in medical school will be wrong by the time you retire.
Yeah. So this is really a common thing that you hear as you're going through medical school. And the point is that, you need to evaluate the information, you need to evaluate what you're viewing as dogma. And the unfortunate reality today in medicine is that we don't do that very well. Doctors, the healthcare system, we've really evolved to a point where the sort of questioning is discouraged. And, when you look at something like heart disease, the messaging is we have it figured out. Like, you don't need to ask the questions. But the evidence in front of us is quite to the contrary. Obviously, we haven't figured out heart disease because it remains the number one killer and it continues to get worse. So I honestly, again, for a large portion of my career, didn't really appreciate that saying. But now I certainly do. And there are now, many, many things that I was told were fact, were dogma, that I now recognize to, some of them are just absolutely not true. Others are really unanswered open questions that we need to investigate further. And I think one of the things that has happened along my journey is I have become more curious, more questioning, and that has certainly made me a better physician.
And to say we have it figured out, I pulled these stats up. Just as like right, if you look up heart disease, this is right off the CDC. You kind of hit one earlier, but heart disease, the leading cause of death for men, women, and people of most racial and ethnic groups in the United States. One person dies every 33 seconds in the United States of cardiovascular disease, and about 695,000 people die in the United States of heart disease in 2021, and that's 1 in every 5 deaths.
Yeah.
Wow. Taking a step back, just historically, in the 1900s, like we're looking early 1900s, it's a rarity, right? It's a rarity for people to have heart disease, and then we kind of get this swing coming up from the 1950s. Can you give some insights on kind of why this big jump going into today?
Yeah. And that's certainly, one of these unanswered questions. So, as you said, um, you know, back in the early 1900s, um, heart disease was basically undescribed. We have reports from the leading physicians of the time summarizing their entire career experiences, and it was rare that they saw any cases of heart disease. And then all of a sudden, here in the US, throughout the first half of the 20th century, from 1900 to 1950, we see an exponential rise in the incidence of heart disease. And it really hits a crisis point, 1955. President Eisenhower, while in office, has a heart attack. And this sets off the alarm bells. And everyone starts asking, what's going on here? And there were really two prevailing theories that were put forward, both focused on foods that we were eating. And one hypothesis was that it was the fat in the food that we were eating that was leading to the cause of heart disease. And the other basically said it was the sugar in the food that we were eating that was the primary cause of heart disease. Now, it was recognized that there were other factors like smoking that also played a role. But ultimately, that fat-focused theory hypothesis won out. It became what we now know as the diet heart hypothesis. And that hypothesis says that when we eat fat in our diet, and specifically saturated fat in particular, our blood cholesterol levels increase. And those blood cholesterol levels being increased are the primary driver of heart disease. And this has now been the prevailing theory around heart disease since essentially, the late 1950s. We have done many things based on this hypothesis. We have changed the foods that we eat. And starting in 1980, the US government had recommendations that, people limit their dietary saturated fat intake and they eat lower fat diets. And of course, not long thereafter, starting in the late 1980s and the early 1990s, we started taking a pharmaceutical approach to lowering people's cholesterol levels. And what we have seen is that despite all those recommendations, despite the pharmaceuticals becoming the leading class of medications prescribed, heart disease isn't going away. And in fact, it continues to get worse. So looking at that logically, one would say maybe that hypothesis was wrong, that diet heart hypothesis. And there are two parts of that hypothesis that we can now say might be wrong. Number one is it turns out that the relationship between the amount of saturated fat we eat and our blood cholesterol levels are inconsistent. And number two is having a high blood cholesterol level isn't the primary driver of heart disease. It may play a role in the heart disease process, but it's clearly not, as we have been led to believe, the primary driver of heart disease.
Awesome. And when the narrative that fat and red meat cause heart disease, what do you say back to that?
I'd say just look at the evidence, because when we go and we look, what has happened over the past 70 years, and specifically, from 1970 to now here in the US, red meat consumption is down something like 30 or 40%, and yet heart disease continues to increase. That is clear evidence to me that those two can't be related as it has been told to us. When you dig further into the science and you look at the studies, and there was just a very large analysis of this topic done, 2021, it was published in the Annals of Internal Medicine, and it was found, looking at the totality of the evidence, that there is no link between the consumption of red meat in isolation and the development of heart disease. Now, you can demonstrate an association between those two. And this is important to understand that, yes, there are studies that show the more red meat that gets eaten, the more heart disease there might be in certain populations. But that is really only because of other habits that people who eat red meat in those studies happen to have. People who eat red meat in those studies usually smoked more, exercised less, and had many other unhealthy habits associated with the red meat. But when you truly isolate the red meat, you find that it has no relationship between the development, its consumption, and the development of heart disease. And one other thing I point out to people is that red meat is the food that we evolved on as human beings. It was the primary component of our diet until very recent times. And somehow we're now being led to believe that it all of a sudden started causing heart disease in the past 100 years when it never did in the millions of years before that.
Yeah, I get all the time, or people contact me or people ask me. I do more of a carnivore diet, and I call it more of a primal aligned diet. If I have some vegetables here and there, I don't get dogmatic about my nutrition where it's like I'm in this camp and that's it. You know, you got like Dr. Anthony Chafee, you know, and a few others and Sean Baker. It's like I'm eating only meat. That's it. This is the way I do it. But I had the privilege of having Bill Schindler on the podcast, and you know, he's like, I'm not a heart surgeon, I'm not a doctor, but what I can tell you is evolutionary. Like we've had this, like kind of you're saying, this diet millions of years, and then all of a sudden you see the rise of agriculture, industrialization, and just so happenly we are now getting unhealthy. But that I think that it's something, this narrative has stuck with people for so long, and it's really hard to kind of shake that.
Well, that's exactly it, you know, and the other sort of phenomenon we're now in is, you know, people have very short memories. So, you know, because this anti-meat message has been repeated so much in the past 20 or 30 years, it's just assumed to be true. And people don't even bother looking into the evidence. And it's, you know, for non-scientific reasons and quite frankly non-health based reasons, the anti-meat agenda, you know, continues to get pushed. But like I said, when you really look into the evidence, it is clear that red meat is not causing heart disease. And I would say that the absence of red meat in the diet and what that sort of pushes people into eating, which is more processed foods, is worsening the heart disease epidemic that we're dealing with.
And what would you say are the main kind of contributors to heart disease? Is it, you know, because genetics, you'll hear people saying heart disease runs in my family. Is it genetics? Is it toxins? What are kind of the bigger ones, or is it more of like just kind of exercise and nutrition?
Well, I think ultimately, you know, it comes down to on a biochemical level, it comes down to a process we call insulin resistance. And what this really ends up, you know, causing is inflammation in the blood vessels. And so anything that ultimately causes the blood vessels to be inflamed is what's going to start that process that leads to heart disease. And we're specifically talking about what we call atherosclerotic heart disease, the buildup of plaque in the arteries of the heart, which is the most common form of heart disease that we see. So inflammation in the blood vessels is what causes heart disease, and that inflammation can come from the foods that we're eating, and pro-inflammatory foods like sugar and like highly processed foods, including vegetable and seed oils, are, you know, the primary dietary offenders. Things like smoking, which cause inflammation in the blood vessels. And then we can even look at something like stress, which can cause inflammation in the blood vessels. And these can all contribute to the heart disease process.
When there's the buildup of plaque, you know, everybody is, again, the mind goes to what the narrative is, and people's like, well, yeah, you know, it's clogged up with there's cholesterol. That's what's clogging up your arteries. You know,
Right.
we find cholesterol in those areas. Can you kind of dive in a little bit more of kind of for like the layman's terms to people to kind of debunk a few things?
Yeah, it turns out that, you know, yes, there is cholesterol in these plaques, but cholesterol is there as the repair mechanism. The body sends cholesterol to repair the blood vessel when it is damaged by inflammation. And so, we got this misunderstanding. And, like I said, it's understandable how we got there, because you look at the blood vessel, you look at this plaque, you see cholesterol in it, and you're like, oh, well, it's got to be cholesterol causing the problem. The analogy, that I've borrowed from others that I like to use is, every time you see a house on fire, you see firemen there. And you could conclude from that these firemen must be setting the house on fire. But of course, we know that they're there to put out the fire. And that's really, what happened with the cholesterol story as well. Cholesterol is the body's repair mechanism for the damage that's done by the inflammation. And if you keep damaging the blood vessel, you're going to build up that plaque over time, but it wasn't the cholesterol that caused the problem in the first place. And yes, you can, see a little bit of an effect of trying to take cholesterol out of the system, lower your cholesterol, does have a tiny effect in all of this, but you can see much bigger effects if you figure out what's causing the inflammation in the first place and you stop doing the damage to your blood vessels.
You made this touch on smoking, and I maybe you can kind of, there's a little split I have here. So there's two different things: tobacco and nicotine, and like separating the two a little bit. So kind of talking about tobacco versus nicotine, because there's a big push, like you'll hear Andrew Huberman talk about it, of, nicotine is neuroprotective. There's a big market of just tobacco-free nicotine. Is there any effects or things that are kind of this tobacco-free nicotine versus having, cigarettes to the heart disease, either contributors?
Yeah, so not an area of expertise of mine, but
Mm-hmm.
certainly, it seems that, tobacco, and particularly when you're smoking tobacco and cigarettes, there's so many other things going on there. I would certainly agree. I don't think it's the nicotine itself that's causing the damage. And, Dr. Huberman, many others that I'm aware of, do promote the use of, you know, purified nicotine, let's call it, as a neurotropic agent. And I wouldn't disagree with that. And I wouldn't have any concerns about someone, for instance, let's say, taking a nicotine lozenge or maybe chewing a nicotine gum as a contributor to heart disease in the same way that smoking is.
Yeah, I think it's getting more popular, I would say, in terms of the, I guess I could say youth now, because the youth are a little bit younger than me now. But like the Zin, and there's like all these other different. They have you said lozengers, but I've seen mints and things like that of just nicotine, and people are using those, and they are saying that they actually like the effects of it, and they feel like there is no downside. But it's kind of good to hear that that's not a contributor of heart disease in itself. And
Yeah,
then
like I said, I think it's certainly the other stuff coming with that tobacco when you're smoking it, especially, that is really causing the damage from a heart disease perspective.
And what about stress? You hear things of people getting heart disease from being too stressed, or a heart attack due to stress.
Yeah. Yeah, so stress is real interesting when it comes to the heart. And there's many different facets to this. So first of all, there is a very well described condition of the kind of stress induced heart disease. The medical terminology for it is called Takotsubo cardiomyopathy. And these are people in very stressful situations that will all of a sudden develop what looks like a heart attack without the actual blockage of the blood vessel. So it's clear that stress has an effect on the heart. Now, when we look at stress and its contribution to, again, atherosclerotic heart disease, the most common form of heart disease, there are a couple of different ways that stress can contribute to the development of atherosclerosis of these plaques in the arteries. There is the direct effect of stress, and stress raises some hormones that can increase our blood sugar, that can contribute to damage to the arteries. Stress can directly increase inflammatory factors in our blood, again, that are going to cause this damage to the bloodstream. And then stress also causes us to do things like eating processed food, eating sugar, for instance, that are going to contribute to this whole process of developing heart disease. So stress is one of the pillars that I always discuss with my patients. Now, it's challenging because you can't just eliminate stress. And honestly, we don't even have great ways of measuring stress and quantifying its effects on the body. So it's a little, it's not as clear, for instance, as saying eliminate processed food or, eliminate processed carbohydrates, because we can't just make stress go away. We all have stress in our lives. It's more how we react to that stress that determines whether or not it's going to, contribute to heart disease. But it's one of the pillars that I talk about, along with the foods that you're eating and the activity that you're getting and the sleep that you're getting or not getting. Those are the four pillars that I look at when we're trying to help someone prevent heart disease.
I'm a very guilty of, if I'm too stressed, I've realized this over the years, that I was just not even thinking about it. Just, I would go for fast food. I would go for red wine. I would go have a couple beers because I have a stressful day. And that's something that I've had to catch myself, and I slip into it now and again of, I want something that's, high carbohydrate. I want pizza. I had a stressed out day. I want pizza. I had a stressed out day. I want to have a beer or red wine. And that was one of the big hard things for me. Now I try to, if I feel stressed, I just go walk. And I never really even enjoyed walking ever. Put a podcast on, put a book on, and just go walk and just say I'm out there for 45 minutes, whether it's outside on a treadmill, whatever. But I see how people get into this habit of, one, just it physically affects you, but two, like, you're going to make some decisions because you are stressed, and it's tough. It's tough to take a step back and actually breathe. We always forget to breathe and take some breaths and, and clear our heads. Because when we don't clear our heads, we're going to do something or make a decision that doesn't help us.
Yeah, and those are two great examples of things that you can do to help you mitigate that stress. Like I said, it's not about eliminating the stress. It's about recognizing the effects that it's having on you and figure out ways to, mitigate that stress. And whether it's exercise, meditation, engaging with community, whatever it is, there are lots of different tools that we can use. But the first step is recognizing that stress and the effect that it's having on you.
And for somebody who is going to the doctor, and let's say they're going to the doctor and they're getting their annual physical or checkup, and getting their blood work, what tests should they be encouraging their doctors to conduct, and also what is available to, like, just, let's just say somebody who's going in that has health insurance available to a patient, and they don't even actually know it's available for them.
Yeah. So the good news is that, the basic blood work that most doctors do can be very powerful in helping you figure out if you're at risk of heart disease and other chronic diseases. I mentioned insulin resistance before, which is a biochemical process that goes on in the body. And, the more sort of generic term for that people may have heard about is metabolic health. And there are 5 basic measures of metabolic health that we can start with to figure out if someone's at risk for things like not only heart disease, but many of the chronic diseases that we face, like diabetes, like Alzheimer's disease, and many forms of cancer. And so the 5 basic measures that people should be looking at, the first 2 you actually don't need your doctor for. You can do it on your own at home. One of them is your waist circumference. So you take a tape measure just above the level of your belly button, measure it first thing in the morning, and that is a very powerful marker of metabolic health. Your blood pressure, which again, you can check it at home. You can, almost every grocery pharmacy store seems to have blood pressure cuffs, the little kiosks these days that you can go get it checked. And yes, every time you go see your doctor, you're probably going to get your blood pressure checked. Blood pressure, another very powerful indicator of metabolic health. And then that basic blood work that your doctor is going to order for you, they just don't interpret it in the context of metabolic health most of the time. You want to look at your fasting blood glucose level. So the amount of sugar that's in your bloodstream when you haven't eaten for about 8 to 12 hours. And then you want to look at that cholesterol panel that your doctor is probably going to spend most of the visit talking to you about. But you're not going to look at the number that your doctor is looking at, the LDL cholesterol, the so-called bad cholesterol. You're going to look at two other numbers on that panel. You're going to look at your HDL cholesterol, what most people will know is good cholesterol, and you're going to look at your triglycerides. And so if you gather those 5 numbers, and you can go to my website, ifixhearts.com, right there, front page, free quiz. You just put those numbers in, and it will show you the parameters for whether or not you are metabolically healthy. Now, the scary statistic is when we look at those 5 measures, and these are basic measures. I would say they're not even the most advanced ways that we can, determine metabolic health. But when you look at those 5 basic measures, the most recent statistics we have here in the United States is that 88% of adults, almost 9 out of 10 of the adults in the United States, cannot meet those 5 basic measures of optimal health. So that is the starting point that I encourage most people. Now, you can certainly go beyond that. I encourage people to get things like a fasting insulin level checked, know what your hemoglobin A1C is, for instance. Those are all great other metrics to have. But if we just start with those 5 basics, at least people will figure out how unhealthy they are and start to make some changes to reverse it.
I'm curious about the waist circumference. Is that like relative to that person's height as well in the information, or is it just kind of based on like your age?
Yeah, so the basic metabolic health screen doesn't take into account height. The parameters we use are under 40 inches for a man and under 35 inches for a woman. And those, I would say, even those are kind of generous. A better metric, is indexing that to your height. And the the goal is for your waist circumference to be less than half of your height, is a pretty good metric to look for. But the reason that waist circumference is an even better predictor, for instance, than weight or body mass index is because waist circumference is going to reflect how much visceral fat you have, how much fat you have on the inside around your organs. And it turns out that the visceral fat is the main source of a lot of these inflammatory, chemicals that end up doing the damage to your blood vessels. So that's why waist circumference is such a powerful predictor.
And let's say somebody is, and this is actually a story that's kind of happened to me, but there's a few people I know this happened to. They get onto the carnivore diet or a ketogenic diet, and there's the increase in their their LDL or whatever. And the doctor, and this just kind of happened to me. I was actually training really hard and doing a lot of endurance racings, and I arguably was in the best shape of my life, and I was doing it all on carnivore. And a doctor, I just went for my physical. They're like, your cholesterol is really high. I'm thinking about getting you on statins. And I was like, I'm like, I'm 34. You know, I feel great. I'm in the best shape of my life. I need to be on that. She's like, yeah, you know, just based off your numbers. I declined it, and you know, I've never had an issue. But what do you say to patients that, you know, that they get that suggested when they go in for their physicals?
Yeah. So, and this is a tough one because in many situations, the doctor doesn't understand this. We've been given guidelines as physicians. We've been educated as physicians that all LDL cholesterol is bad. And if that number is high, we need to bring it down. And we've lost the nuance of it's not really about how much cholesterol, how much LDL cholesterol is in your bloodstream. It's really the quality of the cholesterol and the environment that that cholesterol is in that matters. Because remember, when we talked about earlier, you know, what starts the process of heart disease, inflammation in the blood vessels. And there is no evidence that, you know, an elevated LDL cholesterol in and of itself can initiate the process of heart disease. So um, it also turns out that, you know, not all LDL cholesterol is the same. LDL cholesterol is actually what we're measuring with that test is a family of cholesterol carrying particles in the bloodstream. And yes, some of those particles end up in those plaques that are in our arteries, but some of those particles don't. And this has to do with the size of the particles primarily. And so that's another parameter that we can look at. Now, it's a very complex issue. It's what I spend the majority of my time in my telemedicine practice that I work with patients deciphering and helping them to decipher. There's no simple answer as to whether or not, you know, you should be worried about your elevated LDL cholesterol. But some things that you should be asking your doctor or seeking out another doctor who actually understands this issue and can help you decipher is what is the quality of your cholesterol particles? Do you have inflammation? Do you have insulin resistance? And then, you know, if we're worried specifically about heart disease, the question should be, okay, do you have evidence of heart disease, of this process starting in your heart? And there are things that we can do to determine that. There's a test that I advocate strongly for. It's called a coronary artery calcium scan, and it can show you at its earliest stages whether or not you're developing plaque in your arteries. So these are all, you know, factors that should go into this decision as to whether or not you should take a statin and lower your cholesterol level. And the final thing that I'll point out that people should be asking their physicians about is what are the true benefits of taking statins and what are the true long-term side effects and short-term side effects that people experience when they take statins. Because in general, physicians have been educated in such a way, and they then relay this information to their patients that overstates the benefits of taking these medications and underemphasizes the downsides of taking these medications. So really press your physician. Say, what is the benefit to me of taking this medication? And if they can't give you the numbers, which many of them can't, quite honestly, because they don't know them, it may be time to find a different physician.
Wow. I mean, you're just going into the rant of like all the different things, you know, my doctor just looked at one number,
Yep.
you know, just one number. It was like, yeah, we should get you on statins. I was like, I don't think so, but wow, wow.
Yeah,
That's
and
so
like I
informative.
said, you know, it's not your doctor's fault. I've been there. You know, I went through this process, and the education is really very one sided, and we get a very narrow view of, you know, the data, the science behind it. And more doctors are really being pushed not to think about these issues, just follow the guidelines. And so that's what your doctor is doing. out of necessity, because they're so busy, they really don't have time to think about these issues in many cases. And it's easier just to look at one number and hand the prescription to the patient.
Yeah, on the topic too, like I look at you as like a trailblazer, right? And there's lots of other people that are in the space kind of moving towards this. Do you get any like flack from any doctors or a bunch of people, kind of pushing against the guidelines and asking for more, clarification on things and more evidence?
Yeah, certainly we do get pushback. I oftentimes, sometimes publicly out there on social media will get attacked by other physicians who are calling me dangerous and calling me a quack and all of these things. And honestly, at this point, that's sort of a badge of honor because, again, I look at the results that we are getting from the healthcare system. And I really challenge my colleagues to be honest and say, are you happy with the results you're getting for your patients? Why is it that I am so busy as a heart surgeon? Why is it that heart disease is still the number one killer, 70 years into the battle against heart disease, the war against heart disease that was declared back in the 1950s? And here we are 70 years later, and we've basically made no progress in this. And so I, as a physician, challenge my colleagues to demand better for our patients, demand better of ourselves to be, preventing these diseases instead of just managing them.
Amen. Amen. That's awesome. Eh, what's any projects that's going to be coming up for you? I know you have the podcast, you've had the book that's out. Anything in the works coming up?
Well, basically, my team and I are always trying to figure out more ways that we can help people and try and expand, our capacity. I encourage people to come over to the website, ifixhearts.com. You can see all the ways that we work with patients. We have, self-directed courses that you can take. There's the book, which will give you, the blueprint, the guidelines that you need to be able to stay off the operating table. We have coaching programs, and I do have a telemedicine, private practice where I work with patients one-on-one to help them to stay off the operating table and help them prevent and reverse heart disease and these other chronic diseases that we deal with so much.
Amazing. Well, I'm going to be putting all this stuff in the show notes and make sure that people have access and all the links to your website, book, podcast. And I thank you for coming on the podcast here and sharing your message and shedding some light on some of the struggles that we've had in the medical industry and how you're kind of trailblazing the way to showing there is another way, and this way probably is better.
Thank you.
Well, thanks. And thank you for everybody. We'll repeat that. Thank you, everybody who has tuned in today. And thank you for listening to the Primal Foundations podcast.